Good morning, everybody, and welcome to Radio Rehab, where every Saturday I'm just honored to come and introduce you and myself to people that are in the community recovering from substance abuse issues and mental health issues, but also people that are friends of ours and that care about our community, our 12-step community and our mental health community, and just in general care about the mental health and the spirit of our tri-state. And the guest that I have today, I've known since I was involved in the Teen Power Camp with Youth Resources in the early 90s and with Sarah Davies, Youth Leadership Evansville. This woman, Gail Riecken, has been a friend of the community and has watched women especially suffer with substance abuse issues and mental health issues to the point of it costing them their children and their jobs. And she's always been in the front lines advocating for ways to get help and for all of us to pull together to be good neighbors for folks that have substance abuse and mental health issues. So I've always had a special place in my heart for Gail and an appreciation for her being out there talking the talk that nobody sometimes wants to talk about. So I want to introduce you to Gail Riecken, who is going to be aspiring to be even more involved and more helpful in our community, and she's going to tell us her story and a little about her. Thanks, Gail, for coming.
Thank you, Lisa. Excuse me, I'm looking forward to talking with you this morning.
Yes.
It's been a while since we sat and talked, and certainly Evansville is really, really important to me and the people here. When I think about early on and getting involved in issues that are so important to our families. It started really, when I think about it, in college. And, I was in those years when Kennedy was shot, remember? And our spirit, absolutely, the feeling of participation with people was there. We wanted to help. We wanted to work side by side. And I did that, and I think coming to that realization that we are all part of one big family. I remember a comment by a sheriff in my neighborhood years ago, and he talked about the importance of family and neighborhood and that all being part of the community. And it was as if, if you don't protect your streets and you don't protect the families in your neighborhood, how can you be a family in a community? And that's what it's all about. It's about respecting and working with others. And I got involved with child abuse and neglect early on with the Junior League. It was hurting to know that families would be at such stress, that their children would be hurt as a result. And it seemed like there was more that we could do for families than we were doing. And a couple of us, Carol Gormley and myself, and a few others too, sat with, you remember Dr. Stevens at Mental Health? Oh, yes.
That was before I got here. Was that like the middle 70s?
But a little later is when he got in. We all got involved, and that was in the.
Because I started with Lynn Kyle. Stepping Stone on 7th and Cherry by St. Mary's. So I may have, you're right, I knew you even back then, in the very early 80s.
That's right. And Dr. Stevens said, what we need is a place for people to bring their children when they were in times of stress.
Yeah.
And that opened up doors. It opened up doors to conversation that nobody wanted to have.
Yeah.
A gentler way of saying that we all need to support and help each other. And the Art Crisis Nursery was born.
When was that?
It was called the Art Crisis Nursery.
Yeah,
now the Art Center on Lincoln, but it started in my church on First Pres. And it was a smaller... Like
the middle 80s, late 80s?
Yeah,
I remember that.
And we really did strive to bring people in to help them on whatever level they needed. And now that has grown to a point where people can drop in while they're looking for work. How wonderful.
Yes.
Homeless folks that are looking for a job and don't have anybody to take care of the children. These are all stress factors. So it's been a great service for the community. It's the only one like it in the state.
in the state.
Mm-hmm. It truly is the only one to survive, and it's because the community has embraced it.
Mm-hmm.
I have not been, I'll be honest, I haven't been involved like I would like to in the last several years, but the community has truly embraced the concept and the facility.
That's amazing. So you knew even back then that especially substance abuse and mental health issues were affecting women, which were affecting families.
Absolutely. When I look at what we were able to do then on a small scale, I am particularly excited about what we were able to do on a bigger scale in the state. That was through a couple of initiatives, and I'll mention the one first, and that's the Commission for the Improvement of the Status of Children. Mm-hmm. And that has been headed up and was really the brainchild of Chief Justice Loretta Rush, who's going to be speaking here, by the way, I think on the 26th of August at lunch, and you have to come.
She's when?
Outstanding. It's Equality Day, and it actually has its own website and Facebook, I believe, and you can look there for tickets. It's going to be wonderful. She is totally devoted to youth, and the commission is divided into several different task forces, and we have been working with youth and mental health issues and substance abuse issues. I was astounded to find out how young our youth are that are trying all kinds of drugs. It's something that we really...
The onset age has changed since you and I were in there. It used to be 15, 16, now it's 11.
Yes, it is.
Fifth grade.
And so you have to start younger, talking to children than you ever did before.
Early childhood development, I guess.
You got it.
Yeah.
And the one thing that we really worked on the last year in education was when a child got into trouble, and let's say the child was put into detention or incarceration for a while, they weren't receiving the education that they should, and all the education standards now have been increased so that it's a mandate that they are getting better education, so that when the child comes out and is working through whatever substance abuse or mental health issues, that they aren't far behind, because it becomes this spiraling effect that the youth get in and they can't catch up.
Yes.
So I was real excited to see that happen.
It sounds like you're really looking at ways to reduce stress so that people can get clean and sober and can get healthy and self-actualized and feel good about themselves.
Absolutely, and to talk about it as if it's any other problem that we have in society, because we have to share to be able to solve.
There's still such a stigma. Do you see that too?
I do, and another one of the issues that has concerned me and a lot of folks has been the children that have been born addicted or dependent to drugs. And this is because Mom was on drugs when she was pregnant, and the concern that I have is that we do not have the legal opportunity to interject our services over a long period of time to monitor baby and Mom to make sure that she's getting the support she needs. Yeah. And a lot of that is the prescription. That's all the prescription pills, because when they have a prescription, it's not illegal. And this is rough, because it's a terrible cycle to get into.
It is. That's becoming the new drug of choice, these prescription drugs.
It is.
They're using those too.
And then I had a friend who sent me a message about her son, who did get off. He actually was in an auto accident, and he was addicted then to the drugs. They got him on methadone, and now they can't get him off of methadone.
Yeah, I hear that all the time.
Oh, yes, and that's something that the state is really looking into.
The methadone maintenance programs.
Yes. How do we get
How are we getting them off dependency?
That's right.
Yeah. I guess that's better than having them out on the streets drug seeking, the methadone maintenance clinics, but are they moving them toward autonomy away from the drug?
Absolutely, and that's an argument that happens with the professionals.
Know, in our field too, with you too, in your arena.
I'm one who just sits back and listens and responds to all you professionals, but I know it's a deep-seated argument.
It is. That whole methadone maintenance. Yeah. Well, but there's so many pharmacological interventions now with Vivitrol and naltrexone. It's kind of like the Antabuse of the drug addict.
It is.
Remember when Antabuse, when Miller had that Antabuse program?
Miller, I do.
Oh, my God, and they'd keep them on that Antabuse for years, but the minute they got off, they'd get drunk.
Well, and
so these methadones help, but you got to get them ready for long-term recovery.
Which is as I remember, Vivitrol now is they're doing some of the Vivitrol dependence in the drug court and
it's stepping
itself, right?
Yeah, the treatment programs, Brentwood, they're all offering that to certain people with their chronic addictive disorders.
Because they can get them off of that.
Yes.
And I understand that we hesitated on the state level because of the cost.
It's $1,000 a shot.
Yes.
I
know.
But there's
yeah. But it works.
It works for the majority, yes. And it doesn't foster more dependency.
Absolutely. And that's where we need to go.
Yeah. So it sounds like you've been keeping your antennas up, but your soul was for those moms and kids.
It has been, because it seems as if we really need to look at the very beginning of the problem for the children and the families that have these problems. And if it's not just the prescription drugs, it's the other substance abuse. And I don't believe that we have a handle on how to work with moms and families successfully in those situations.
Yeah.
Professionals tell me that as well, that we just do not have the right professional methods and manpower to really solve the problem and to interject ourselves successfully in the families.
Yeah. And I think, a man that's a drunk is still called a man. A woman that's a drunk is called everything but a woman.
Yeah, I know.
So we still have a long way to go just for the woman, the shame and embarrassment. Nobody's talking about the dads that are home drunk and stoned and doing drugs. It's mom.
There's a great prejudice for mom, and there's very little tolerance
for the women.
That's
women. Right.
It is true.
So I'm glad you're out there advocating for them.
Well, there are a lot of us that are advocating for them. As long as we come to a solution, and that's what I'd like to see, and that's what needs to happen on the state level, is that we really need to look at the issue. Absolutely, it's solution-oriented.
Don't go away, Radio Rehab. We're talking to Gail Riecken, who's been interesting, and don't hesitate to call if you want to ask Gail any questions. Her heart and antennas are up with this issue and how it affects the families in our community. So we just have to take a minute break, and we'll be right back. We're back talking to Gail Riecken. Please don't hesitate to call 424-1400. Now you have to add 812. Nothing's below the belt if you want to hear what Gail thinks about anything. She's been very open and full of love for people getting better and having happy, productive lives, because that makes happy, productive communities. We were talking about the solution.
Yeah.
And we were talking about Marveline Prince, who used to do this, and she refers to the substance abuse issue in our community as a cancer.
Absolutely.
But Gail, it sounds like you're seeing there's some solutions that we need to start looking at the treatments of it and the solution of it.
Well, absolutely, and I am seeing more of that. I would say in the state legislature this year, we saw the greatest jumps toward recognizing and funding problems in mental health. And that's what we have to do. It's out there. Let's deal with it. And I don't know how all that started, because it's been, the last 4 years, I would say, I've seen the mental health community trying to get in the door. We have youth resources, you say, and Youth First.
Yeah.
And that's helped so much, because Youth First in particular has come up and testified and has.
Oh my God, they've got social workers in the schools.
They do, and they know what's
That's
going on, and they're saying this is the problem. We've got to really deal with the underlying problem, which is the mental health of our young people as well. And we funded this last year. The young people who were not Medicaid eligible, for them the serious problems to get help. That started this last year and should continue. And
So money's available.
Money is available.
I mean, people can get well. Is that what you're saying?
Absolutely. And
tap into it.
The Healthy Indiana Plan is another avenue for people for funding for their problems, and I think certainly the HIP program.
Yeah. Do people know about that?
No, I don't think so.
So you have to end up in an ER.
Yes.
Yeah.
And that's a shame, but it's a first step. I mean,
that's right.
This is
a great step.
Absolutely.
It pays for treatment, right?
It pays for treatment.
That's big.
It is big, and we just need to do more.
Yeah.
And I think when you were talking about getting in the younger ages, I think that is where we are having our hardest time now. It's because we can't accept the fact that the young people are doing what they're doing. And all across the board. It's not just an income level.
No, it's not.
It's not certain areas of the community. It's everywhere. And we need to understand it and need to address it.
Start believing it.
And start believing it. Yeah.
Now, you first did a survey that showed, 7 out of 10 kids do not end up in trouble with drugs and alcohol.
That's true.
But the 3 that do out of the 10 create more problems.
That's true. It's not the majority, but it's our few that are slipping through the cracks.
Yeah.
And so, excuse me. And sometimes, and I think with what the schools are doing in terms of their recognizing the differences of children and the kids that are falling through the cracks, and what can we do to help those kids too. That's in
celebrating
education.
the diversity.
Absolutely.
Sheila Huff at Bosse. Do you know Sheila?
Oh, yes.
Immediately she'll address if she thinks a kid is. She'll send them to the youth first counselor, and she'll follow up and make sure the parents are getting into counseling.
Oh, I didn't realize that. That's wonderful.
Yes. In fact, she was going to do some research to see, and she doesn't have the time while she's doing this, but how many young people were children of addictions and how that affected their learning.
Wow.
Even elementary level, before, just their learning.
Absolutely.
Now there's all that research that says some women that smoke cigarettes during pregnancy, that's why we have so many more ADHD kids.
What you hear.
The autism.
Yes.
Yeah, she's got the parents on board as well as the kids. Sheila Huff does.
Well, I think that we have a lot of the principals and a lot.
Yes.
We really do. We have a great number of teachers and parents who are very interested and want to do more.
They're really open, EVFC now.
They are. It was so good. We hear so much about the unhappiness of the teacher. And last night I happened to be at a table with she's a teacher, and she said, "I love my job."
Yeah.
And I said, "I am so glad to hear that you're happy, and because you are really, really important to us."
Yes. Yeah, so it looks like you see from the State House to the Criminal Justice and Judicial House to just the neighborhood that we have to have the same page going on.
We do, and one of the first things I became involved in on the state level was reorganizing and redesigning the infant mortality system. It's a network of committees in each of our communities that looks at the death of a child up to a certain age and determines if there is a trend. And on a local level, they gather the statistics, and it goes to the state, and the state looks to see if there are trends. And
is this Vanderburgh County?
Vanderburgh County is involved, yes. Vanderburgh County, it's now under the new system, actually puts it under the prosecutor as the organizer. And they've been meeting. We've always had a strong group here. Unlike the rest of the state, there have been some problems in other portions of the state. And it's important to know and to plan and to program because we have been very high in infant mortality in the nation.
I didn't know
we
that.
were third. We're in the top.
No.
We are still in the top 10.
Whoa!
Why? We are, and at this point, I think we are below the national average. Why? There are a lot of reasons. It's prenatal care is one of the outstanding, the access to prenatal care.
The access to it, because there is prenatal care here.
There is.
It's the access, or them knowing it's there for them, maybe.
Well, and education too, and I think we need to get that out. That's really important. Absolutely, and sometimes that's difficult. We don't have it in the schools. It's
the OBGYNs, maybe?
Well, what has happened is that there has, and it hasn't reached here yet, but there is a statewide public awareness campaign that is going on, and it was designed this last year. And we have seen a little bit of it here, but we need to see more. And I am advocating now to have this campaign down here. It's excellent, but it is talking about what mom can do to prevent or to lessen the chance of infant mortality. Because I think any of us are upset about that.
Yeah.
It's also sleeping habits.
Really?
Yeah.
Is there substance abuse related to that, you think?
Yes, I think some of it is.
Yeah. Wow.
Yeah. So that's always the situation. And infant mortality is one of those keys to a healthy community. That's how we are viewed nationwide and internationally.
Really?
Is on the treatment of our very, very young. So we have to get a handle on it. Extremely important. Probably one of the most knowledgeable and outstanding of physicians in the state is Dr. Del Rio Hoover.
Yeah.
She's been a leader in the issue.
That's true.
Yeah, she really has been. Not only in this, but neonatal syndrome, the child that's born dependent. She's extremely involved. And I think we're doing better. We just constantly have to educate and
like
help
you
mom
said,
to
get
understand.
A focus, get into the solution. Because I have a friend that's a nurse in neonatal intensive care, and she too says so many of them are drug addicted, and the babies come out addicted, and then the parents are afraid to get honest about it because you'll remove the child.
Absolutely.
So there's that fear of honesty too that maybe we could talk about.
We sure can. Now, they are doing a different screening. There is a new method, and the hospitals are trying to improve their methods to be able to screen at an earlier birth age, because that's part of the problem when mom goes home, how much they know about baby before baby starts really reacting. And
so in the first trimester, you mean, if mom's addicted?
I'm talking about after the baby's born.
After they're born, okay.
And because baby going through this, if you can imagine the withdrawal.
Right.
A lot
if they turn them into the cops,
I guess, in the hospital. They have to turn it in if they're...
Well, yes, but if it's prescription drugs, it's a different situation. That's where mom actually has the legal right to take the pills. So because she has her prescription,
right,
so it's difficult with that baby, and we're seeing more of those
the prescription drugs, and the moms just are afraid to be honest because they're afraid. At least the women I've worked with, that they'll lose their children.
Well, that was always the case with whether it was neglect or child abuse.
Yeah, it's a fear of being honest.
You're afraid to get help because somebody will take your child, and I don't want to say it's just toward mom, but usually mom's the one that's the caretaker. Right. But it's dad too.
Yes.
And we can't push.
But we do
these
react
issues.
different to moms. I know that from drug court. A man that was drunk driving that had a child in the car was definitely looked at differently than a mother that was drunk driving with her children in the car.
I think you're
like
right.
aghast that a mother would do that.
Well,
but it's an illness.
We need to stop judging.
I know. Thank you.
Because it does not solve the problem.
And it just makes it harder for moms to reach out for help. They're afraid to be honest about it.
Absolutely. And one of the things I've noticed in being on the state legislature and helping people with their individual problems, because we do a lot of that. Folks will call if they're having trouble getting their Medicaid or if they're having trouble with any kind of government service, but they also will call if they do not understand an issue or with their child or their grandparent. They'll call for different. I have all kinds of different calls.
Oh, I bet.
I really do. And the one thing that I have noticed is that when people call, they are so desperate for help by the time they call us.
Isn't that the truth?
That there are so many barriers for them to get that help.
And make that first call to you already is...
Absolutely. I mean, because they've already been through the system by the time they get to me.
Yeah.
And I have to stop and just say, usually to them, it's okay. I'm not. Just tell me what the situation is, and let me have the facts, and I'll look into it, and then we can start fresh.
It sounds like you don't just offer sympathy; you offer empathy, and empathy is very different than sympathy. In fact, Judge Trachman even said he wants his team to be empathetic as well as sympathetic, because a lot of people are sympathetic, but empathetic means I can only imagine what it's like to walk in your shoes. And for you to say how hard it was for them and how many barriers they got through just to call you shows you have empathy. You see how difficult it is to reach out.
It is. I think it's absolutely.
And to be honest about where you're at.
Absolutely. And Lisa, all the years that you've been and working with people, I mean, my hat is off to you, because it's just it's so important. It's giving opportunity to people.
Well, we love what we do, don't we?
We do. It's whether or not it's young children that deserve the right to a healthy, happy childhood, that opportunity, or an opportunity for a good education if they're incarcerated. I mean, anywhere. And then an opportunity for a good job. I mean, that's what it's all about.
And I'm encouraged to see folks like you up there at the rooftop, being the fiddler on the roof, saying, hey, we need to talk about this. We need to make noise. We need to make it easier for people to come and find us. Don't go away, Radio Rehab. If you have any questions for Gail Riecken, don't hesitate to call here. We'll take a break for our sponsors and be
But you don't see it with the mental health.
Yeah, oh gosh. Gail and I, we are rocking and rolling here, and don't hesitate to call, or if you want to write, or she's going to leave you the Gail Riecken for Mayor website too. But we were just talking about how substance abuse and mental health can be considered a disability.
Yes.
But it's not a disability that a lot of your neighbors see you getting better at, unless, like me, I'm in AA, so I see success every day when I go to an AA meeting. But most people don't see that kind of excitement and success about alcoholism.
Don't see it. Don't talk about it. You're right. I have a couple of friends who are very open about their alcoholism.
Right.
And it has helped me.
But only 2 friends out of all the friends you have.
I have no idea how many.
Yeah, they
seriously,
won't talk about it.
No.
Right.
And we are so ready to talk about and to see and to witness and to celebrate somebody's overcoming a physical disability. But when we don't do that for folks who have a mental disability or alcoholism, drug addiction. We just don't.
You're right.
We really don't. And we were talking about what can we do to help our community. Well, I always say that the first thing we have to do is stop judging each other, because that really stops people from getting help and to be successful. We have to
them in
stop
denial.
that. It certainly does. But the other thing is let's celebrate the successes. We don't, and I know you do in AA when folks go to those meetings, but
it's very anonymous. Yes.
It's not me and other people out in the community. It's not on the front
page
of the
You all don't see what's going
Press.
on in AA.
Absolutely not. Absolutely not. In fact,
that's true.
We hear about the 12-step program, and some of us know what it is, but I bet you, if you ask 10 people what the program is, you may have 1 or 2 that would know what it is and know how successful. I mean, seriously.
You're right. It's because it's been so anonymous and so successful at staying anonymous.
Yes. And I don't know if that's where we should be today. I mean, it should be anonymous, but those that want their successes out there or to feel good about them need to be able to tell us.
Yeah, because most people think I have to go to rehab.
Right.
They don't know you can go to AA. It's free and it's successful. They don't know it. You're right. They don't. The general public doesn't know about it.
No, and I bet there are teen AAs going on that a lot of people aren't aware of.
That's right. And Alateen, which is for the teenagers who have parents that are addicted, and Al-Anon, Families Anonymous for parents with addicted children. Yeah, the public doesn't know about that stuff unless they Google it or know what to even look for.
How can we get that out, Lisa? I mean, I really think there is a role
I think you're
for
right.
all of us there, and I don't exactly know. We have job fairs, we have social service fairs, and I'm thinking about a fair that I went to recently. Do you know there was job and social service, but I don't think there was anything on mental health
or addictions.
I know, the Drug and Alcohol Institute. Remember that the University of Evansville did for 25 years was the only thing once a year where you could go and really tap into those resources. Now USI has taken it on, but you're lucky to have 100 people, educators, clergy, because they're not getting... You don't get paid for the training anymore that you used to get. But there's websites they can go to and find access to these meetings. But you would even have to know that that's even out there.
There has to be a way that we can do better.
Yeah, that might be something to talk about. The solution, how to get that solution out there.
And I really think that's with the funding, the increase in funding
with the HIP.
Well, yes,
that's exciting.
It is, and the state putting more money into mental health treatment for children who are have severe problems.
Yes.
I mean, we're seeing more and more. I also think the other thing that's helped is that there has been more money that has gone into social service through the state Department of Child Services.
Yes.
So that social workers are being paid more. And we need more social workers. We need more people who are willing to work with the children. In fact, Senator Becker and I have been working. Really, it's been the last 3 years. She's dynamite.
She's been in this forever, like you have.
Oh, but
you two could jumpstart the city. Wow.
She's wonderful.
Yes, she is. She really was there when we started Youth First, Dr. Wooten and Mushkan, when we just started the closing of the Mulberry Center, and Youth First picked up. Vanita was right there, and Greg, what was his last name? Server.
Greg was there, absolutely.
He was there with you. Yeah, you. See, some of y'all have been around a long time.
And I see Greg just at least once in Indianapolis, they have a legislators' dinner for Southwestern
Indiana.
Yeah.
But you all have always been about the kids.
Absolutely.
And me too. There's just something about the youth we have to tap into.
We have to. And what I was mentioning that she had been involved in and still is, and I am, is being able to expand the programs for social workers here locally so that we can get more training through USI.
Yeah.
It is competitive in wage now, and now's the time for folks to be able to take advantage of that. And we need a lot more social workers.
Oh, yeah, and they need to know. I teach a class out there. I'd love to have you come out. They're social workers, future social workers. It's an addictive disorder, which you can't use that word anymore if you diagnose it's supposed to be dependency. But the class is addictive disorder and treatment options. And when I get to the topic of how we deal with it in our communities, I'd love to have you come out and talk to those kids that are going to be social work graduates.
Oh, more than happy to, because we need to keep them here in southern Indiana.
Yeah.
That's part of our problem.
And to know that from your level, at the state representative level and where you could be heading next, that you do care about these issues. I think I hear a lot that they don't know in City Hall. Unless you get busted, nobody knows what's going on. And you're saying, yes, we do.
Yes. Oh, we have to.
Yeah.
I mean, it's about people.
Yes.
Government, whether it's on the state level or the local level, is about people. And like I say, opportunity, and that's what that truly is. I was sitting with an African-American gentleman who is now retired, very successful in business. And he said to me, give me opportunity. And let me go my way, but deny me opportunity, and I'm going to go your way, and it won't be pleasant. And I thought, oh my gosh, we need to take that seriously. That people have a right
to opportunity.
To opportunity, absolutely.
That's a good point.
We
Absolutely.
Really do. And if we are able to, I call it ramp up the opportunities to be healthy, happy individuals in this community, we're really going to see ourselves grow.
Yes, I think we already have. We've come a long way since you got in this in the early days.
Absolutely, absolutely. And I was talking with one of the girls that was in junior league years ago when we got
back in the day.
Back in the day, yes, back in the day when most of the women weren't working.
Right, and had time to do all that.
I keep staying in the minority, I guess. But when talking about the issues, and we thought, we've come a long, long way.
Yes.
Another service that was started with the Junior League that is just wonderful and helps Mom is Little Lambs. Have you heard of that?
I've heard of it, yes.
It's at my church now. They have their own little store.
First Pres?
First Pres, absolutely.
I love your pastor. He does stuff with my rabbi.
Yeah, I know.
They do sharing of the pulpit together. They're like the God Squad. They're awesome. He's awesome.
Such buddies.
Yeah.
It's Rabbi Mazo.
Yes.
Did I say yes?
Yes.
He was recently at church.
Yeah, yeah.
And they slap each other on the back.
Oh, it's great. I call them the God Squad. And Father Steve once in a while gets in the mix too. Yeah,
good.
Yeah.
And Little Lambs, the reason I think it is also important to this is that it's a voucher system where if Mom or Dad or whoever is signed up in the voucher in the system attends their counseling or their doctor's appointments or whatever, for the child up to a certain age, they'll get this voucher, and it allows them to come in and get either new baby items or diapers or all that.
Really?
All those things that are very expensive. Absolutely. And it's an encouragement.
Who tells them about it? That's awesome. The doctor?
The doctor's supposed to be saying that they also in counseling, yes, they're supposed to be telling them about it. They have to sign up. Just sign up.
For Little Lambs, yeah.
Just sign up. And we
Where? Where do you sign up?
You sign up with the social worker or the psychiatrist.
At Little
or the doctor.
Lambs.
Well, you sign up with the provider.
Oh.
And they'll let you know about it. And then you
Wow.
come into Little Lambs. Yes, they'll recommend.
That's a great incentive.
It is an incentive.
Yeah.
It's about healthy parenting, healthy baby, and all those things that are really important that we're talking about today. And it's about staying in that system. So if they would go to a stepping stone or they would go to an AA meeting, they should be able to get a chit, which would help them buy diapers. I think it takes 3 of those vouchers to buy diapers.
Wow, I'm going to have to tell people at Brentwood about that.
Absolutely.
To tell the women in there, too, about these incentives that are out there. I think, like you said, Gail, there's just, people don't know what's out there. And
No,
that
they
there
don't.
is a winning team.
Absolutely.
There's a lot of winning folks doing stuff out there.
Absolutely. And we just, and if we haven't found the solution yet for that certain age group or that certain, we need to discuss it and find out what to do and where to go.
Yeah, yeah.
No reason that we can't develop
right.
a system that's going to be more supportive of people.
And user-friendly. And
user-friendly.
Easier for people to get honest with us about things, the more they see that out there. Don't go away, Radio Rehab. We're going to wrap up talking to Gail Riecken, so if you have questions, now's the time to call. This is our last break for the sponsors, and we'll be right. We are wrapping up talk. I could talk to Gail for the rest of the day. We have so much excitement about possibilities for the community. So tell us, Gail, what do we need to know? How can we work together? Where are you headed from here? How can we know where you are and keep
Lisa,
track of you?
I'm very, I'm committed to being able to work in our community. Once again, I've been gone for the last 6 years during 3 and 4 months every year when I'm up in Indianapolis, and I miss Evansville. And there's so much that we can do here that I've learned about in Indianapolis and want to bring home. We can and be that community that we really want to be. We can do better. There's no reason for us not to do better, and it's all, like I say, it's all about people. That's what really makes us strong. And I would like to see that we look at the issues, these issues and other issues that folks know are so important that are keeping people from being, or what should I say, from having the opportunity for everything that they can possibly be. I'd like for us to get that on the table. Let's talk about it and see what we can do better in this community, because I know that we can.
Yeah, to open those doors.
Absolutely. And if I'm fortunate enough to be in the position I would like to be, which is mayor, we're going to have an opportunity for someone to take my position in Indianapolis. And I sincerely hope that we have people who are just as willing to work with individuals as well as structures to be able to talk about these
issues.
Absolutely.
It's not always looking like a winning team. It's not always looking like a fiscal, advantage, but
And I can remember when we started talking about the Commission on the Improvement of the Status of Children, and we started talking about, well, we don't just want a representative from these departments. We want the head. We want the commissioner. We want the director of that department. So there's 13 of these top people, the decision makers, the people that can actually make the changes, can sit there and say what they want.
Wow.
We're talking about
we have a caller?
That.
Oh, we have a caller. The red didn't go off. I apologize. 1 minute, Gail. We've got a caller. Good morning. Welcome to Radio Rehab.
Lisa?
Yes.
And my mother is currently going through some classes at Brentwood Meadows for mental wellness services, and I already can see some differences, and she just completed her first week of classes. She's got one more to go, and I'm totally blind, and I'm in a facility right now myself trying to get some rehab so that I can walk, because I have cerebral palsy. But I went to Brentwood for some addiction services. I love Brentwood, and I really didn't want to leave it, but the problem I find is that I have a pain condition that requires me to need pain medicines. And the problem is that it's so readily available to people that don't need it, and not so readily available to those of us who do need it.
Yeah. Yes.
Because my condition is cerebral palsy. It's degenerative, and it's getting worse as I'm getting older. But I wanted to call and say that Brentwood Meadows is, if my brothers were still alive, we might still have them if there had been a Brentwood Meadows, because insurance doesn't want to pay for care because people have to go through it maybe 6, 7, 8 times before, something clicks in.
Yes, thank
but
you.
They were real good at accommodating me. I got every need met.
Well, good. Thank you for calling.
And I went to every single class that was available to me. I even had patients leading me around. I felt like everybody's little puppy dog because everybody was fighting over who was going to get to lead me around. And
well, we appreciate you calling in. Gail and I were just talking at the first segment about what you're talking about the availability of these narcotics for people that truly are in chronic pain, Gail. That the clinics that people abuse it, and then there are people like this young girl that need it.
Absolutely. And we have to discriminate between those that really need it and those that are abuse it. And the abuse, like I said before, it can come without you really knowing it.
Yeah.
I mean, all of a sudden, you can't live without it, and you're doing better down the road, but you've become addicted to it. So, yes, I'm so glad she called in. That was
and just talking about how important treatment is, and that's what you've been saying too. We've got to get in the solution, and if treatment's the solution, we need people like you talking about it at the macro level.
And there's no reason that we can't talk about it. Again, it's not judging. It's saying that we all need to be well and happy.
Yes,
we need that right.
That's right,
and that's what this is all about.
Yes. A happy Evansville. So we've got a few minutes left. Is there anything, ways that people can get a hold of you, anything you want to leave us with that you're thinking or want us to know?
Yes. If there's an issue that's on the state level, it's very important that we know what your problems are, and because I can work with them. I have an assistant there, and we have liaisons to every department, and we can work through all the issues that you might have. And the best way to get a hold of me there is simply to email giga@iga.in.gov. And if you use Gail.Riecken, it gets at the same place. Gail.Riecken or giga@iga.in.gov.
IGA.in. Okay.
And then also, and those would be for all those issues on a state level. And I want to hear more about how people think Evansville can be more successful in helping folks that have problems with addiction. And that would be through GailRieckenForMayor.com.
Just your name, Gail.
Just my name. If you go on,
ForMayor.com.
For Mayor, and they can get me through that website.
And that's where people can come and talk to you. And I know
Absolutely.
Stephanie's a really good friend and fan of yours. And her openness and her willingness to shout from the rooftops, too, that we need to get better at the city level at talking about these. Yeah.
Absolutely. And it's if somebody is responsible to get a solution for them that works for them, they need to be celebrated. And so I feel very strongly that I'm glad she's coming out and she's talking about it.
Great.
That's great. Absolutely.
And if people have ideas, too, even people like in our recovering community, if they have ideas of how we can work better.
Oh, yes.
With you, to email you at gailriecken@mayor.com.
Whatever folks feel will help help improve our community to be more supportive and solution-oriented. That's what we need, and that's what I'd like to hear.
Good. Well, I'm so excited that you're trying to make the world a better place and an easier place, especially for women, and men too, but women to come and get honest if they do have depression or anxiety or substance abuse issues. Thank you for that dedication, Gail.
Thank you, Lisa. It's good to talk with you.
It's always good to talk to you, and thanks for taking a Saturday to come and talk to us.
More than welcome.
Thank you. Bringing Jason along, too.
Yes.
Your new guy, huh?
Yeah, Jason.
Yeah, Jason.
Welcome, Jason.
Yeah, Jason. Hi, Jason. Jason's kind of hot. So, Gail Riecken's whole agenda is pretty hot. I think these are hot topics and hot issues, and we need to put some heat on these things and get some stuff done for sure.
Absolutely. It even gets to the point of transportation. How do we get people back and forth to these
I hear that a lot, that they don't have the transportation.
Absolutely.
True. We didn't even talk about that.
No, we didn't. It's not just, it's the services that need to wrap around somebody who's trying to help themselves.
Yeah.
And
I never even thought about transportation's an issue.
Oh,
I hear that a lot.
It is an issue, and I don't hear it discussed enough in relationship to certain places that people need to get to, in addition to work. But if you're coming back, if you've had a problem and you're getting back into society, transportation back and forth to work and the available treatment centers is extremely important. It's critical.
It is. Yeah. I know intensive outpatient at Deaconess Cross Point, even, or at Brentwood, there's no buses.
Right.
Yeah.
So we need to look at that. There is a report out that's going to be next Wednesday at 6:30 at CK Newsom on the transportation plan.
Ooh.
And it would be important for people who do have input about facilities that need to be on that bus route to make sure that those facilities are there.
Great. Thank you so much. God, you've got so many things to think about. Whew. Yeah. That's a lot. All right. Well, Radio Rehab, thank you for tuning in. And if you have any questions or comments, you can get a hold of Gail Riecken for Mayor.com. You can call here, call me. I'll get to Gail or Jason, and we'll make sure to get your answers or yourself heard at that level. Thanks again, Gail.
Thank you, Lisa, and thank you for all you do for the community. Appreciate it.
Thank you. And thank you, Jason.